Hey everybody, Luke here, and today I want to talk to you a little bit about taping and whether or not it's beneficial and useful in terms of your recovery process. So the reason we're talking about this is that it's a very common question we get with patients here in the clinic because in general we're using tape on a fairly regular basis. So whether we're talking about like kinesio tape, which is that flexible stretchy tape, or McConnell tape, which we use mainly for knees, which is a little bit more of a sturdy just solid tape that we use for repositioning things. Just want to kind of talk about it and let you know where taping fits in the recovery process and when you should use it. So overall, one of the biggest concerns people have is, well, should we be taping, or is it just kind of a band-aid basically? Is it just, am I going to have to keep taping if I keep taping now, or if I start taping now? So it's kind of that question of, is this really helping me get better, or do I have to keep doing this constantly into the future just to experience any pain relief? And it's a great question to have, and usually the way I explain it is that taping is basically something that helps us transition from where we are now to where we want to be. So let me explain it in terms of like a common person coming in with like knee pain. So a lot of times we'll use McConnell tape or several variations of kinesio tape depending on what structure we're trying to support early on. So let's say we take a patient who has like patellofemoral pain, which is that pain along the front of their kneecap. And we're using McConnell tape to take that kneecap, and we're going to take the tape, and it's pretty, like I said, sturdy, and we're going to reposition it towards the inside of the joint. So that basically, most folks, when we apply it, they have decreased pain along their knee when they're wearing the tape. And again, without the tape, they have more pain. So we tape them up early on in the rehab process. And what happens is that tape, which gives them less pain, now allows them to do their exercises more comfortably. So with this specific type of patient, we want to start working on things like strengthening the muscles around the knee. So that's like quad strengthening, maybe some shallow squats, knee bends, things like that. That again, without the tape wouldn't be real comfortable, so we couldn't do. So early on, the tape is definitely useful, and it's allowing us to start to strengthen these muscles in a much more comfortable fashion. So the question then is, well, do you have to keep using the tape in order to have this pain relief so that you can exercise? And the answer is no. At least ideally not. That's where we're trying to go. So with this situation, which is again is an easy example, the tape is holding the kneecap in good alignment, which makes it more comfortable to exercise. As we're strengthening these muscles surrounding the knee and the hip, those muscles are going to do the job of the tape, and now you should be able to exercise and strengthen comfortably without having to use the tape. So hopefully that makes sense. So the tape is a good thing to use early on in the process to help you get to a certain level where your muscles are now basically doing the job for the tape. Sorry for the noise. Apparently there's a fire nearby. We'll just wait a second here. So again, you look at the title of today's video and blog, is tape helpful? I definitely think it's helpful. You don't want to develop dependency on it, although at the same time, you'll see athletes where if you're going to do something really rigorous, like a really intense hike or a sporting event, you might use it then kind of prophylactically just to give yourself extra support, similar to like how you might wear a knee brace for a given event. So if you need it once in a while, I don't think it's a bad thing, but certainly you're not looking to have to wear your tape every single time you want to do anything active. So I hope that explains it. And if you're going through the rehab process with us or with a different PT, you might ask questions about, hey, would adding some tape be useful in the process of getting me from here to there, giving me some pain relief now so I can do the exercises more comfortably? Or if you're in the rehab process and you're trying to do some athletic events, you can question your therapist on whether taping would be useful during the event just to give you some extra support and stability. So I hope that helps with that question about taping. Again, there's a lot of ways you can use taping, whether you're taping ligaments, muscles, joints, things like that. There's some really creative ways you can use tape, and I definitely think there are good uses for it within your recovery process. So hope that helps, and if you have more questions, just leave a comment or a question below the video. Thanks for watching.